Hello and welcome to your daily COVID-19 update for today, Tuesday, August 16, 2022.
So over the last 24 hours, we've had 91 new cases, and we did 771 tests. Currently, we have 484 active cases across the country. We currently have 13 persons in hospital, 7 persons at the Ocean View Hospital with 1 in the ICU. So currently for first dose adult, we are now at 445,523 doses. That's about 86.8% of our adult population. Second dose, we are now at 345,210 doses, or 67.3% of our adult population. For the 12 to 17 age group, we have administered 35,502 doses. That's 48.7% of that age cohort. And second dose is 26,010 doses, or 35.7% of that age cohort. The ages 5 to 11, we have administered first dose 7,407 doses, second dose 2,500 doses. So first dose is now approximately 7.3% of that age cohort, and second dose would be 2.4%. Boosters, now we're currently at 71,856 doses. So if you're sick, well, the CDC guidelines actually, if you have tested positive, for you to isolate for 5 days. But those 5 days are rather arbitrarily determined because people can test positive for more than 10 days after it was determined that they had COVID. So, but the guidelines are there. We have adopted a mid-road approach, so instead of 5, we have been doing 7. And persons can do self-testing to see whether or not they're still positive. If they're not positive, they can come back out to work. We have to maintain the operations of the hospital because the systems that we have put in place is to make sure that we have centralized oxygen, for example, and therefore we have to maintain the entire hospital. We have, as you would know, capabilities of managing 198 patients there. We have an ICU of 52 beds. We have already identified a section, and with monkeypox, we have a number of measures that we have already taken. One, we have developed guidelines for the treatment of monkeypox. 2, we have laboratory people who have been trained to do the diagnostics for monkeypox. We have brought in the reagents so that we can do PCR tests for monkeypox. So once we have a sample, we will be able to test it and identify the virus. And we have an infectious disease response team. So if a doctor suspects they have a case of monkeypox, this specialized team would be able to respond to go and assist that physician in making a determination whether that's monkeypox or not. Because the presentation can mimic other diseases, and therefore we would need to do a differential diagnosis to make sure that this is really monkeypox. So we have that specialized team that is available in case we have a suspected case. And we have already set aside an area in the hospital where, if it is necessary to isolate those patients, that we can isolate them there. Now, for most patients with monkeypox, that presents with monkeypox, The reason why we hospitalize them is basically sometimes patients would present with a lot of pain, so they'll need pain management, not necessarily to. So this is something, if it is necessary to isolate those persons, then we can isolate them at the facility.
You have been watching the daily COVID-19 update for today, Tuesday, August 16, 2022. I'm Natasha Smith-Thomas. Goodbye.